Good afternoon, everyone, and thank you for joining us today. We will go ahead and get started. I know we've got several folks who are joining us, but for the sake of time, we will go ahead and kick things off. My name is Mackenzie Simmons, and I have the privilege of serving as the project manager for SAMHSA's 988 Crisis Systems Response Training and Technical Assistance Center that's operated by Altarum. Today's webinar is an introduction to SAMHSA's 988 Crisis Systems Response Training and Technical Assistance Center. This presentation will provide an overview of SAMHSA's priorities as well as strategic goals and objectives. Additionally, it will offer an overview of the Crisis Systems Response TTAC goals and TA offerings that we will provide. Finally, it will allow for our audience today to share insights regarding challenges surrounding the implementation of crisis systems and the opportunity to ask questions. Before we start, I'd like to briefly introduce today's speakers, Monica Johnson, John Palmieri, and Elizabeth Waitzig. Monica Johnson, in Behavioral Health Crisis Coordinating Office. Ms. Johnson has worked in the behavioral health field for 26 years and most recently served as the interim commissioner for the Georgia Department of Behavioral Health and Developmental Disabilities. John Palmieri is currently serving as the Deputy Director of the 988 and Behavioral Health Crisis Coordinating Office within the Office of the Assistant Secretary. He provides subject matter expertise and policy leadership in areas that include crisis response, suicide prevention and interventions, care integration, telehealth implementation, and criminal justice diversion programs. Elizabeth Waitzig is a founding and managing partner with Change Matrix LLC, a minority and women-owned small business that motivates, manages, and measures change to support systems that improve lives. She partners with individuals, organizations, and systems as they define, create, measure, and sustain change. Now let's take a moment to ensure that everyone in the audience is ready and comfortable with the technical aspects of this webinar. I'll now turn it over to my colleague, Lauren Mitchell from the SAMHSA TTAC communications team to walk you through the webinar interface, including how to submit questions and other technical information.
Thank you, Mackenzie. If you have any questions or comments during the presentation, please enter them into the chat area. They will be sent directly to us, and we will attempt to address all questions during the Q&A session after the presentation.
Thanks, Lauren. So as Lauren mentioned, if you've got questions or comments during the presentation, please enter them into the Q&A area, and I will now turn the presentation over to Monica Johnson.
Thank you, Mackenzie. Welcome, everyone. I'm so excited to be with you today. Just a little bit about me and why today is so important and why I'm excited to do this welcome with you. So as Mackenzie lightly touched on, I have spent many years in state government, coming from the state of Georgia. Prior to that, I spent well over almost 26 total now, but so many years in the community settings, inpatient and outpatient, and have had the distinct honor of joining SAMHSA in January of this year as the director for the 988 and Behavioral Health Crisis Coordinating Office. Uniquely, so we just reached our 1-year anniversary of 988 being live, and so I've had some opportunity to reflect. And what I figured out is that I spent the first 6 months on leading the implementation of 988 at a state level. And then, of course, the last 6 months leading from this space. So I have a very unique lens, and I hope I get to keep my street credibility for all the time that I've spent in communities as well as in state government. So why today is so important and why today matters. So from that previous experience and what I know now is that 988 did one thing, whether it was intentional or not, we all are having a conversation about what it means for individuals in this country to experience support and or treatment when they are having a mental health, substance use, or thoughts of suicide, any type of crisis related to behavioral health. So we're all now having this conversation, but what has been profound to me, and as I've gone around and had an opportunity to visit with some of these states and see up close and personal how this is being implemented across the country, what I do know is not only are we having a conversation about what that experience is, what it should be when you dial 988, that you not only have someone to answer, but that you have a response system capability, rather that's mobile crisis or something else, and that people have a safe place to go for help if that is what is needed. But it also starts this conversation about access in general. So what I have learned is that unintendedly, I don't know, maybe it was planned this way by design, but every single country, territory, our Native communities are all talking about their crisis continuum at one time. That is extraordinary. But what comes with that, as positive as that is, are learning pains, growing pains in terms of how do you do all of this huge system transformation, because it's beyond the number, right? And so how do you do that? And so what we're here today to do is introduce to you one of the ways in which we want to partner with you and help walk with you alongside you as you continue to be leaders out where you are, implementing, whether that's at the community level, provider level, at a local municipality, at the state level, wherever it may be, that we can be responsive to having the training and technical assistance to help support you in the ways that are meaningful, in the ways that really are impactful as you do the work that you're set forward to do. So I'm excited today. I hope that you all will take full advantage. I have a funny feeling I won't have to coax anyone, but to take full advantage of this new opportunity to be able to make sure that we're putting out good products, that we are connected and in tune to what your needs are. So it's a good day. 988 is growing, and I am so excited to be here with you today. I'm going to stay on the whole time because your questions matter to me, helps me keep my finger on the pulse, because it is important that what we put together for you with our partners, with Alturum, and other partners that will be helping to influence this work, that it is meaningful and that it matters. We're not just putting together this TA center just because to check a box. So we want this to be meaningful for you all as you do the very complicated work of building out your systems and really walking alongside us to reach one of our primary goals, which is to transform the way we do behavioral health crisis in this country. So with that, I will wrap up my welcome, but I will be here the whole time, and I will be checking the chat and just monitoring what's happening. So with that, thank you.
Thank you, Monica. That was a really warm introduction. So with that, let's turn our attention to our next presenter, John Palmieri.
Thank you so much, Mackenzie, and thank you, Monica. Monica, really appreciate your energy and the enthusiasm that you've brought to the 988 office and to SAMHSA with respect to the focus on crisis systems transformation. And like Monica, I have come to this work really from a number of different perspectives, certainly as an administrator, as a clinician, as a trained psychiatrist, and as a family member who has been impacted by suicide. And we know that this is something that impacts all of us and touches all of us in many different and complex and tragic ways. And so really appreciative of the opportunity to be in this role and to be here to talk about a significant resource and a significant accomplishment in the growth and the development of the 988 office, to partner with Alturum and all of you to bring additional resources and expertise in our training and technical assistance landscape to support crisis systems transformation. You can go to the next slide. So one of the things I will say is that in some respects, this moment brings tears to my eyes a little bit, because we have been waiting for an opportunity to lean into the training and technical assistance work that we know is necessary to transform system development for quite a while. And there's lots of great work that's happening already. And so obviously a good and important function of the coordinating office and of Alturum and our work together will be to partner with all the great work that's already underway, that has been accomplished in the years and the months leading up to the 988 transition, to amplify a lot of that fantastic work, to partner to address gaps, to continue to analyze where there are opportunities for leaning in for more improvement and in-depth analysis and work. So really excited about all of those partnership opportunities. So here, just taking a couple of steps back, looking at how this work with the 988 office and within the Training and Technical Assistance Center fits in with SAMHSA's larger overall strategic priorities. And many of you probably are aware that SAMHSA recently put out its revised strategic plan for the next several years. And you can see here that enhancing access to suicide prevention is a key strategic priority for SAMHSA at large. And that's obviously the most direct call out to the work of the 988 office and to the work of our Training and Technical Assistance Center. But if you look across all of these priorities, you can definitely see points of intersection where our collaboration and our work will have an impact across a lot of these different areas, including preventing overdose, including strengthening workforce, including supporting emotional well-being and resilience for youth, children, and families. And of course, understanding that everything that we do, everything that gets shaped through the Training and Technical Assistance Center will have guiding principles, some foundational elements related to equity, related to trauma-informed care, related to data and evidence informing practice development and practice adoption, and obviously framing all of this through a recovery orientation and a recovery perspective. You can go to the next slide. So here, just again, I know many of you have seen this before, but I raise it here again because it's one of the reasons that we're here. It's really the most important reason that we're here, that we know that there are many people who are not able to access care, who have challenges finding help when they need it, and that there are major downstream tragic consequences of that lack of access to care with respect to suicides, with respect to overdoses. And we know that not everybody feels this burden equally. And so when we think about the Training and Technical Assistance Center, ultimately, we're looking to drive changes in these tragic outcomes in the long term. We want to be able to have an impact so that suicides are decreased, so that overdoses are decreased, so that inequities are addressed in access to care. And we recognize that through the Training and Technical Assistance Center, there's lots of interim steps that we can take along the way to have a meaningful, enduring, lasting impact on these outcomes through improving access, through improving quality of care and practice adoption, through improving sustainability, through workforce and financing, through improving awareness and utilization of the service and trust in the service. So these are all things that we're going to be looking to partner with all of you on as, again, we work to improve these long-term tragic outcomes for people in crisis. Next slide, please. So we have talked a bit about our role within the 988 office and SAMHSA as a whole around crisis system transformation. And so within the 988 office, we have had two overarching goals that we have talked about quite a bit. One being the lead federal organization, the lead federal agency supporting the 988 Suicide and Crisis Lifeline, obviously through the transition to 988 and certainly post-transition as we continue to work on expanding capacity, expanding access, expanding language access as one example, expanding services for marginalized and under-resourced populations. And so you can see here some of the ways that our office is driving many of those efforts across the federal government and across the country through grant-making capabilities, through coordination, through the development of communications tools, and ultimately laying the foundation for what we see as a critical behavior change campaign to encourage people to seek help when they need it and to build trust in the Lifeline network as a whole. And then on the right side here, you can see the other large overarching goal, which is very much focused on that piece around crisis system transformation. So continuing to articulate, modify, evolve the vision for crisis services, building, of course, on the 2020 national guidelines that were published. Also coordinating across the federal government, again, recognizing that certainly SAMHSA has a lead role, but there are many federal partners who have critical equities in the crisis space, whether that's CMS or HRSA around financing our workforce, or CDC, or our evaluation partners. There's lots of federal partners, or the VA or the FCC. Again, lots of federal partners who have an important role to play with respect to crisis system transformation. And then looking outside of the federal government, obviously looking at all of you, state, local, territory partners, tribal partners, nonprofit organizations, private sector partners, technology leads, telecom providers, payers. Everybody needs to come to the table to be able to deliver on this opportunity. Related to that, we also recognize a very important focus on data quality and data integrity to be able to understand how the system is performing, how do we measure that performance, and then how do we use evaluation to drive continuous system improvement. Next slide, please. So here I like this slide because it really positions the Training and Technical Assistance Center within this sort of triad of strategy, practice dissemination, practice adoption, and evaluation, recognizing that there's a very complex interplay between these three so that the strategy influences the Training and Technical Assistance Center, the evaluation of those services influences the strategy, and then what we put out moving forward. And so very excited that we are now at a place where we can move forward with a lot of the things that we've been thinking about, that we've been building toward, many months and years of work, national convenings that have happened, laying the groundwork for a lot of what's to come. So very excited for this moment and partnering with all of you moving forward. And so I'm going to turn it back over to Mackenzie to talk a little bit more about the logistics and the nuts and bolts of the contract. So thank you.
Thanks, John. So yeah, we wanted to take a moment to further speak about the Crisis Systems Response TTAC and our goals. So SAMHSA selected Altarum to provide training and technical assistance to support states, territories, tribal organizations, and community partners across the 988 Suicide and Crisis Lifeline and Crisis Continuum of Care, along with our partners, W2 Consulting Corporation and Change Matrix LLC, who have extensive experience with crisis services, technical assistance, and health equity. The Crisis Systems Response Training and Technical Assistance Center, or TTAC as we'll refer to it in the future, was formed to support the continued growth of 988 Lifeline and build a more robust crisis care system. Next slide, please. We wanted to further describe the goals that we have for the TTAC. So looking specifically around supporting a crisis care system that's integrated, sustainable, equitable, and aligned around evidence-based and evidence-informed practices by assisting in integration of the 988 Lifeline with 911 and mobile crisis services, increasing access to mental health and substance use related crisis services, convening experts and leaders in behavioral health crisis systems, which we are doing currently with our advisory group, and developing and disseminating materials to improve crisis systems and services nationwide. You can go to the next slide, please. We also wanted to talk a little bit further about what you can expect from our TTAC. We will be presenting more webinars as well as learning collaboratives, publications, toolkits, training workshops, site-specific technical assistance, virtual and in-person convenings, as well as evaluation tools. Next slide, please. So upcoming, we have another webinar that will be delivered on October 12th. You should have gotten the registration for it, and if you haven't, please look at the link below as well as the QR code that's associated. So this webinar series is part 1 of 6, and it is on connecting to serve promising practices for 988 and 911 collaboration. Again, it will be on October 12th from 1 to 2:30 p.m. That's Eastern Standard Time, and it will focus on the foundation of the 988 and 911 collaboration. Next slide, please. So without further ado, I will turn things over to Elizabeth for our interactive portion of our presentation.
Thank you so much, Mackenzie. Let me please first start by saying I want to add my welcome to this, to all of you here to learn more about the TTAC and about SAMHSA's vision for the 988 Crisis Systems Response. This is a really, really important launch pad for this work, because as you could hear from John and Monica, there's been an awful lot of thinking about, from SAMHSA's perspective, about why this is important, what it is, and and how they envision it rolling out with all of the priorities that you saw embedded in this work. You also heard that we wrote a proposal to be part of this effort as the TTAC. And when you write a proposal, you all probably know this, you put in your imagination of what you'll do and how you'll do it and what the outcomes will be. But none of that really matters unless we hear from you. And so I really am so fortunate to sit on a number of TA centers, both with HRSA and with SAMHSA. And one of the things that we see ourselves as TA centers is sort of in some ways a bridge between the vision of the funder and the government and the folks like you who are doing the really, really important and complex work of system building in your communities and tribes and states and territories. And so we wanted to figure out, how do we engage you all in helping us learn a little bit more about what you're facing in your systems building and implementation. And so we have put together what we call a thought exchange. And I want to take a moment to tell you a little bit about what this is, and then I'm going to share my screen and give you an opportunity to talk to us. So the first thing about the thought exchange is that you're really asking one powerful question. And the powerful question that we're asking here is, what is your biggest challenge in building and implementing your crisis system? So again, what is your biggest challenge in building and implementing your crisis system? So here's how this is going to work. In a moment, I'm going to share my screen, and there are two ways that you can engage this platform. One is by a QR code, and you can use your cell phone and hold it up to the screen where you see the QR code and go right to the platform. Or there's a link and a code that you can use, and it will also take you to the very same place. Once you get there, it'll ask you a couple questions first. We wanted to know, for example, how do you describe the place where you're building and implementing your system? Is it a rural area, an urban area, a tribal area? So get an opportunity to answer that. We also wanted to know a little bit about the role that you play in building and implementing your crisis system. So there's a pretty long list of things that you can check off, including a not represented on this list for those of you who don't see yourselves in that list. We're asking a little bit about you so that we can understand how groups of people respond to this question. But I want to assure you that this is anonymous. There's no way for us to de-aggregate the data, the thoughts that come in, so that we can tell who you are. So please give us your most honest feedback. And this is how we're going to ask you to do it. So the first thing that happens is you answer this question with a thought. What is your biggest challenge in building and implementing your crisis system? And so you'll give an answer to that question first, and then you'll be offered the opportunity to say why that's important to you. Why is that thought important to you? And you can give as many thoughts as you want, but please give one thought per answer. Do not put a whole 5 different thoughts in one answer, because it makes it hard for us to organize them on the end. So one thought per answer and a why that's important to you. And once you have exhausted all of your thoughts, you've given as many thoughts as you want, and absolutely you can do this on a desktop, on a phone, on an iPad, any device that you have, you can access this. So once you've given thoughts, and 15, 20, as many as you want, or one, that's okay too, you'll get an opportunity to have the thoughts of others come your way. And this is what's unique about Thought Exchange. So you're going to get an opportunity to star or rate the thoughts that you see. Now, I want to caution you that this is not a good idea or bad idea sort of situation. It's a, how much do I agree that this thought is from my perspective, from where I sit, how much do I agree that this is one of the biggest challenges, right? So if you strongly agree that this is one of your biggest challenges, you'll put 5 stars. If it really doesn't work, that's okay too. And I'll give you the link in just a minute. No worries, we'll get there in just a second. Just to let you know what's going to happen with the data, we are absolutely going to show you as it's happening, how thoughts are coming in. And And it looks like people are already participating. So I'm going to go ahead and share my screen, and we'll go ahead and get started. The time has elapsed, but please feel free to continue adding your thoughts and your stars. I want you to know that as of this moment, there are 246 thoughts shown here and 3,433 ratings, which is amazing and super, super helpful. So I just wanted to take a moment to go through some of these, just so you know what you said right off the bat. I saw just in a quick scroll an awful lot about workforce shortages. In fact, that is the #1 starred thought here. There is a national shortage of behavioral health professionals, including those who specialize in crisis response. And then the second highest rated thought, ensuring workforce available. The third highest rated thought, workforce, inability to adequately staff newly developing programs. Needing mobile crisis staff, workforce. Here's one that's a little different. Understanding the data discrepancies between Vibrant and 988 carriers and having data that is useful. Okay. So for chat and text, both state and centers are flying blind on how to appropriately build capacity because they're not given the information that they need. We've got some more staffing here. Oh, the enormity of the task. This is a big task, building a system. Workforce. Oh, funding. I don't know that I've ever done a thought exchange where funding did not show up on the list, because that is a perennial, continuous challenge for system building, no matter where we are. Lack of mental health professionals, more workforce. I'm just gonna, there are a couple of slides that we can go through. I'm gonna take you through them somewhat quickly. Please keep filling this out if you want to. We're up over 4,000 starred thoughts. So let me just show you a little bit about how this works. So these are some of the biggest thoughts. These are just the thoughts, and we went through some of them. Long-term sustainable funding showed up. I thought I was going to be able to show you some of the slides here, and I can't. So we'll just go through a couple of other thoughts, and it looks like really funding, staffing, relationship strain between the state and Vibrant, staffing, technology, coordination between Vibrant and the states. This one is a little bit new, attempting to bring together multiple systems and organizations working in silos. Those of us who have been doing TA work in mental health for a while definitely recognize that one. Staff retention and hiring new staff. Building close collaborations with 911. Check out that webinar coming up. Workforce in rural communities. Responses that are real. Face-to-face. Diversion leaves it open for recurrence. Respond, resolve, and stabilization. Okay. Again, please feel free to continue to use this. Typically, you are sent thoughts that don't necessarily mirror your own. We're going to organize this data and theme it. So there's going to be a big thematic chunk of thoughts related to workforce. There's going to be another big thematic chunk related to financing and budget. And then there will be probably a chunk related to system building and collaboration. That's what we're seeing so far, without having gone through all of the 272 thoughts. So I guess I would, I'll stop sharing my screen, and I'd love to ask John, if you don't mind me putting you on the spot, or Monica, if you choose to also weigh in here. What does this look like to you? Is this what you expected? Is it a surprise?
I mean, I think that probably flagging workforce and sustainable funding are two of the things that we hear the most consistently with respect to challenges and barriers around the crisis system transformation. So not a surprise. I mean, I think it's validating for, for me and for us to recognize that these are areas where it's really important for us to continue to lean in through our partnerships, through the work of the TTAC, to be able to make sure that we're disseminating opportunities and amplifying opportunities for growth in this area. So appreciate the feedback, and it very much is aligned with a lot of what we've been hearing on the ground.
Yeah, so I'll just jump in there. I concur with John. I was over here writing fast, but so I didn't see anything that was surprising. Pretty consistent with what I thought. No surprise about workforce having such a significant theme. The other ones I'll touch on that weren't surprising, but I think it's the undercurrent of all of this, is the complexity of doing this continuity of care. Because to John's presentation, that ecosystem that is required to do this work, this is not an easy lift. And so no entity can do it by themselves. And so I think a part of some of those pain points, which I'm just going to call them really growing pains, goes back to the expediency of which this is happening. Because of the catapulation of 988, everything is going faster. And so it's expected that there be tensions, because there's different relationships forming, there's different collaborations having to be formed in order to really do this work. Again, it takes a whole ecosystem. So I wasn't surprised there, but I do think that that undercurrent shows up in different ways, but not surprised that you're going to have those strains. And then we use the word collaboration loosely. I think it becomes but it's different. Really understanding how to engage and form collaborations that really deliver on outputs when your control may be limited, or your goals and your funding may be siloed, and you have something you have to drive towards. So finding that common shared goal, I think is easier said than done. So these are the kind of things, though, that I was expecting to hear, and where I feel like the TTAC can be of great assistance.
Monica, thank you so much for that. I was thinking a little bit about how in the system of care world that we really support at NTAC, and it's the same thing, right? So we can say, here are all the folks who need to be involved. That's not the hard work. The hard work is, how do they come together and create a shared purpose, shared process, shared resources, and communication to make it all work. So I was really glad to hear you say that. Thank you so much.